Hello, my name is Talisa Ramirez. I'm going to be doing the BSN 206, the Foley catheter insertion video. I have all of my supplies. I have on the appropriate scrubs. I do have on my badge, but for the purpose of the video, I am going to be removing the badge because I do not want it dangling over the sterile field. I do have all of my supplies, so I'm going to get started. I'm going to knock on the patient's door, perform patient privacy, perform hand hygiene. Hi, my name is Talisa Ramirez. I'm going to be your nurse today. Can you tell me your name and date of birth? Because that is accurate based on the armband. So Ms. Jones, today what we're going to be doing, a Foley catheter. Your doctor ordered it. It seems like you're having some urinary retention problems. So we are going to get the catheter to help you out. Before we start, I do want to let you know a couple things. Try not to touch your area or any of my supplies. We want to try to keep the field as sterile as possible. If you at any time experience any pain, please let me know. So I am going to, if you have any questions, please let me know. I'm going to position the bed to the appropriate height, lock the bed. I'm going to position my patient supine. Ms. Jones, I need you to put your feet together and put your knees outwards. Okay. So Ms. Jones, what we're going to be doing, I'm going to be cleaning your peri area. So I'm going to perform hand hygiene again. I'm going to put on my gloves. Like I said, Ms. Jones, we're going to be cleaning your peri area, so you're going to feel me touching you. And I'm going to just get the rag, and we're going to, with water and the no soap, we're going to do the side furthest away from me, front to back. Switch the rag over. Side closest to me, front to back. Move the rag over again. Do the middle, front to back. Okay, we're gonna trash that, dispose of that one. Then we're gonna dry it. We're gonna pat dry. You don't wanna rub it because you don't wanna be rough on the patient's skin. So we're gonna start with the side furthest away. Switch the rag over, closest to me, pat it dry. And we're gonna do the middle, pat it dry. Okay, we're gonna toss that. So now we're going to inspect the meatus. Everything looks fine. Nothing that should hinder me from doing the Foley catheter. So now I'm going to remove my gloves. Going to perform hand hygiene. I'm going to remove my Foley kit. Place that into the trash. I'm gonna open up my kit. Get my gloves. Using my 2 fingers, I'm gonna open the gloves up. We're going to start with the dominant hand. We're gonna pick it up with the 2 fingers. And we're gonna use the 4 fingers to do the non-dominant hand. Okay. We're gonna toss the sterile glove paper into the trash. Now I'm going to get my drape. All right, Ms. Jones, I'm going to put a drape under you. So I need you to lift your hips. 1, 2, 3. And we're gonna make sure that we put the drape the shiny side down. Okay, Miss Jones, I'm gonna put the other drape on top of your peri area. Now this has been used for practice purposes, so that is why it's ripped. If this was in a normal hospital setting, I would not use this. I would get a new everything if it was ripped. So we're going to drape the peri area. Okay, so now I'm going to get my supplies together. So we're just gonna move this here. And we are going to open up our swabs. They have been open for practice purposes, but I'm going to push them up to make them easier to come out. We're gonna open up the lube. This has been opened previously as well for practice purposes. I do have just a little bit left. Okay, you want to toss that. Then we're going to open up our syringe and connect it. Take the cap off, toss the cap. Then we're going to connect the syringe to our catheter, making sure that it is in there. Okay. Now we are going to get out the Foley catheter. Okay. Put that into the trash, and then we're gonna put it into our lubricant. Okay, so what we want to do is start cleaning the peri area again. So Ms. Jones, I'm going to clean you again. You're gonna feel it's gonna just be a little bit colder, but it's gonna be basically the same as the first time. So going to position my hands, grab one of the alcohol swabs, the furthest away from me, go down, front to back. That's what I'm trying to say. Side closest to me, front to back, trash, and the middle, front to back, trash, and then you want to trash the paper. So now we're gonna get the Foley catheter, making sure that it does have the lube on it. And you want to grab it 2 to 3 inches. Okay, Mrs. Jones, I need you to take a deep breath in and exhale, and then I'm going to push in the Foley catheter. Are you ready? So we're gonna go 1, 2, 3. Okay. I'm gonna push it in until we see urine. Okay, I see urine, so I'm gonna go 2 more inches in. Okay, now that it's in, I'm going to hold it so that I can put in my fluid, the sterile water. And you want to put all of the 10 mLs. Are you feeling any pain? Okay. Okay, now that we've done that, we want to disconnect it, put this into the trash. Okay, so now that we have that in, we want to pull on it a little bit, see if we can meet some resistance. Okay, I feel some resistance. Are you okay? Feeling any pain? Okay, so now that we have done that, we are done with the procedure. Now I'm going to get the drape off. I'm going to rip the drape. Okay, and we're gonna get that from under her into the trash. Okay, so now I'm gonna just get another rag and I'm going to wipe off the excess lube that may be there. We're gonna wipe on the side furthest away from me. You're gonna be patting it dry. Flip the rag. Side closest to me, patting it dry. Flip the rag again. And now you want to do the middle, but be careful when doing the middle. You don't want to pull the catheter out. So now that we have done that, we want to toss that as well. Now what we want to do, we want to get the catheter bag out. And we are done with sterility, so we want to move all of these things to the trash. To the trash. We want to put the lock onto her thigh. To open up the bag. And you want to put it on the immovable part of the bed. And okay. Okay, Miss Jones, are you experiencing any pain? Okay, so now I'm going to take off my gloves. Perform hand hygiene. Okay, Miss Jones, I do want to let you know a couple things. If you need to get up or move around, please use your call bell. If you experience any pain, please use your call bell. I'm going to position the call bell next to my patient. I'm going to perform hand hygiene and document the procedure. And that's it.